Sorry, is it visible?
Yeah, please continue talking.
Yes. So, sir, we have one problem. We have one. My organization Sun Pharma is developing a novel drug product in which we are facing that in initial analysis itself, many a times drug product fails. It is challenging for us because we have to control. Otherwise, when we are trying to move to the next phase of scale up to the plant, before that we have to resolve this issue to avoid batch failures there. So my project title is the reduction of batch release failure in the novel drug product. The problem statement is that a particular critical quality attributes, which is the assay of the drug product is many times fails. So drug product A is having variability in batch release assay, and few times it fails on lower side of specification, and all other CQs are not having those kind of failures, whatever data we have at our R&D. So there is another option available for us. Is there are two options available with us. One is either to reduce the variability which we are getting in the initial assay, or we can widen the specification. But the problem in the widening the specification is initial itself we will do wider specification. That shelf life we will have less shelf life for the drug product. So we have to reduce the shelf life of the product. So, for example, if we are targeting 18 months, we have to target them 15 months. So that 3 months of that advantage we will lose if we write the specification. So our organization wants us to reduce the variability, so we will not lose those profit. So my project goal is this: to reduce the drug product assay variability at batch release to such a level that risk of failure becomes negligible in current specification, and so that there will not be need to widen the specification that leads to the reduction of the shelf life. And current batch release drugs assay specifications are 98 to 102%. Currently, in project scope, currently we are taking percentage assay of the drug product. We are taking in this scope. Simultaneously, we are taking the input material quality and packaging material quality also, because we have this infusion bag. So plastic material is there, so there are chances. So those kind of parameters also we are taking into consideration. Manufacturing process, bulk preparation to filtration, filling, terminal sterilization, these steps are also we are taking in the scope. And very important thing is analytical methods also we are taking in the scope. And the out of scope will be the formulation composition. So we will not be able to change the formulation composition at this stage. So composition, quantitative composition we cannot change. So this was the project scope. And then expected business results were future related projects. So it will prevent future failures of the drug product release at plant, and meeting current specification will provide expected shelf life, that is 18 months. Higher shelf life provide better result in terms of optimum resource utilization, cost saving, and ultimately improve the profit to the organization. Business impact will be approximately 10% cost will be avoided by reducing manufacturing, inventory management, and analysis cost for 15% extra batches, which we may have to prepare extra because of the reduction of the shelf life. So those we can avoid, and then approximately 10% cost will be saved. So in our team structure, champion will be our manager Samad Kumar will be there, myself will be team leader, and then I have one team with me. So those will be the team scientist. And I have a timeline. I have defined timeline here to complete this project. Where defined phase I will be completing this 15th phase. I think mostly I have done. So that I will complete in 15th August. Measure phase, because we have much more historical data. So those data we will be evaluating till 30th August. And after the completion of measure phase, we will start analyze phase and complete it by 25th October. Improve we will be doing by 20th December, and control will be 31st December. So this was the from project charter. Some preliminary data I have evaluated, like last 25 batches, R&D batches, initial essay I have pulled out, and then I have checked for this control chart. That is there any assignable variation or is there like natural variation? So I have performed this normality test, there it is passing, and then fluctuations we are seeing on the right side, that is the variation we are observing in this drug product in initial, though it is in control, but we need to reduce the variability. And then I have calculated capability also for this data, and I have found that currently it is a 2.5 sigma level. So this was from my side, sir.
Okay, come back.
Which slide you want to see, sir?
Yeah, come back. Yes, come back to the first data where you have the normality test.
Yes.
Show the slide where you have the normality. Yeah, stay. Now, tell me very clearly. You are going to do the project on new product, or you are going to do this on a regular production?
No, this is under development, but it is we have to transfer it to the plant. This is under development project. So
no, first of all, your voice is breaking. I can't hear anything properly. I'm asking my question again. Answer the question, huh? Because otherwise it is not taking me anywhere. You want to reduce variation of product which is under development or product which is under production?
Under development.
No, your voice is not clear. I can't hear anything.
Give me 2 seconds. I will connect from my mobile.
You talk from your mobile.
Yes, sir.
Okay. Now don't keep two systems side by side. Then you'll have echo. My question to you is: you want to do this project for your new development or for your regular production batches?
No, it is for new development. So this is undergoing. Development is undergoing. Formulation has been developed. Finalized. Composition has been finalized. But only thing is, before taking to the production to the plant, you have to ensure that this variability gets reduced.
So no, I understand. Milan, I am a regular consultant to a medicine manufacturing company. So I understand all these terminologies. Okay.
Yes.
So I have no problem. So batch release means the first batch, right?
First time we will perform analysis. It's a 0-month analysis.
Yeah. So release batch means how many batches?
So what kind of process will be there?
Your voice is not clear, yaar. Can't hear anything.
It is released for us, then it will be put on stability. So that is the stability. So there will be two kinds of analysis. One is the initial release, and another is the stability. So this antidoting is about release, initial release. So whenever we manufacture batch, we will have analysis of this critical quality attributes, but from that, SI is one of them.
Milan, you have to learn to speak less. Please speak the one-point answer. Whenever you develop a drug, how many batches you produce for release?
So 50 to 60 batches we manufacture.
For one product?
Yes.
Now you have shown me data of 25 batches. So this 25 batch is for a single product or different products?
For
single product.
Yes, sir.
So now, are you going to do your project on this product or some other product?
No, and this product only.
So how you have 25 batches for release? You produce 50-60 batches for release, huh?
No, not for every batch will be released. So release means there is
These are
analysis,
regular
initial
production
analysis.
batches.
No. It R&D also we release it. We will generate data and there will be COA available and that certificate of analysis. That time of release in R&D also will take that.
You are not helping me with your answer. First of all, you have to have the clarity. So these 25 data for the single product?
Yeah, it is single product, different batches.
Different batches. Regular production batches?
No production batches. It R&D only. These are R&D batches.
R&D batch itself. Okay, fine. So
yes.
I am assuming they are all R&D batch.
Yes.
Right?
Yes.
Now, just a minute. Go to the next slide. Now, R&D batch itself is unable to meet the spec.
Yes, sir.
So there are batches where the assay value was below 98.
Yes, sir.
Right? So you can
yes.
see the distribution is on the lower side. Can you tell me one thing? Is it really feasible to improve assay without touching the formulation?
Composition we don't want, but yeah, because API we receive, they have assay values and we calculate and we'll add those things, and during manufacturing also certain fluctuations will be there.
Don't use the word manufacturing, they are all R&D batches. Answer the question. You have a habit of not answering the question, telling something else. I'm asking as a technical man, you answer me, yes or no. Is it feasible to improve assay without touching the formulation? Yes or no?
Yes, sir.
Very good. So, which process has to be improved? Come back to your project charter. Come back, stay here. You have a bulk preparation, you have filtration, you have filling, and you have terminal sterilization, right?
Yes.
So tell me which process has to improve the assay value?
So bulk preparation is the one. Filtration will be the one. Filling may not be that much relevant.
So bulk preparation and filtration, right?
Yes, and terminal sterilization.
Three things. Now bulk preparation, after you prepare the bulk, which are the parameters you check?
After preparation, bulk assay value, pH and related substance.
They can't hear anything.
Hello, am I audible?
No, you are not audible at all.